In the shadowy world of parasites, one microscopic organism stands out for its cunning and adaptability. Welcome to the realm of Toxoplasma gondii. Toxoplasma gondii is a protozoan parasite that infects species of warm-blooded animals, including humans, and causes the disease toxoplasmosis. In France, consuming raw or undercooked meat elevates infection rates, while Central America's stray cat population and climate foster high exposure. In the U.S., seroprevalence was 22.5% in the early 1990s, dropping to 15% among women of childbearing age. Recent NHANES 2009-2010 data show an overall seroprevalence of 12.4% among individuals over 6 years old, with 9.1% in women aged 15 to 44. These findings underscore the varied epidemiology of Toxoplasma gondii and its impact on public health. Toxoplasma gondii primarily resides in the intestines of felons, such as domestic cats, where it reproduces sexually. Oocysts shed in cat feces contaminate soil, water, and vegetation. It also forms tissue cysts in various warm-blooded animals, including humans, predominantly in muscles and the brain. Gondii adapts to diverse habitats globally, from urban areas with high cat populations to rural regions with abundant wildlife. Toxoplasma gondii is a single-cell parasite with two main forms. Tectozoites, fast-replicating, crescent-shaped cells with a single nucleus, causing acute infection. Bradyzoites, dormant forms within tissue cysts, similar to tachyzoites but slower and less active. Oocysts of Toxoplasma gondii typically shed for 1 to 3 weeks, but large numbers can be released during this time. After 1 to 5 days of sporulation in the environment, oocysts become infected, leading to infection in intermediate hosts, birds, rodents, etc., which ingest contaminated soil, water, or plant material. Toxoplasmosis in humans is often acquired through ingesting contaminated meat or cat feces. The parasite multiplies in the intestine, spreading to lymph nodes and distant organs, causing necrosis. Humans can become infected by any of several routes: eating undercooked meat of animals harboring tissue cysts, blood transfusion or organ transplantation, transplacentally from mother to fetus, consuming food or water contaminated with cat feces or by contaminated environmental samples, fecal contaminated soil, or changing the litter box of a pet cat. Lymphadenitis is the most common manifestation. Symptoms may include fever, malaise, muscle pains, sore throat, and headache. It can also lead to severe encephalitis in immunosuppressed patients. Symptoms may include headache, disorientation, drowsiness, hemiparesis, reflex changes, and convulsions. In severe cases, coma and death can occur. Immunity to Toxoplasma gondii develops after initial infection, primarily through the action of T cells and the production of specific antibodies. This immunity typically prevents severe disease upon subsequent exposures by controlling the parasite's replication. However, it may not fully eliminate the parasite, leading to the formation of tissue cysts that can persist for the host's lifetime. Diagnosis is based on serology and on histologic examination of tissues such as Sabin-Feldman dye test, indirect fluorescent antibody test, indirect hemagglutination test, latex agglutination test, modified agglutination test, and the enzyme-linked immunoabsorbant assay and biopsy or necropsy. Diagnosis: congenital infections can be achieved by detecting T. gondii DNA in amniotic fluid using molecular methods such as polymerase chain reaction, PCR. Sulfonamides and pyrimethamine are two drugs widely used to treat toxoplasmosis in humans. Folinic acid is often given to prevent certain side effects of pyrimethamine, such as bone marrow suppression. Sulfonamides, such as sulfadiazine, sulfamethazine, and sulfamerazine, are all effective against toxoplasmosis. If patient cannot tolerate sulfadiazine, clindamycin can be given as an alternative. Trimethoprim sulfamethoxazole is a combination of antibiotic that can also be used to treat toxoplasmosis. Particularly